autoclaves or autoclaves in general, as we use it for medical devices and medical equipment in general. As dentists, since we run a surgery, it's important that we utilize methods to keep the instruments and devices in our clinic and handpieces in our clinic absolutely sterile, well wrapped, and ready to be used on a patient without having the risk for infection. So hence today's topic is very general to every medical or dental practitioner, and it's important to know certain things. So in today's session we'll discuss what are autoclaves. We'll also discuss the types of autoclaves, the uses of each class of autoclave, and some handy tips on what to do for handpiece sterilization, which may be more relevant for the dental fraternity that are following me today. So yeah, starting with what exactly is an autoclave. So we have two methods of sterilization for medical instruments and dental instruments. One is using dry heat and the other is using moist heat. So when we are using moist heat for sterilization, the medical device that helps us to use that is called an autoclave. So essentially it is the most common sterilization device which uses moist heat for its microbicidal action and helps us to keep our instruments sterile. So going ahead, what are the types of autoclaves that we usually deal with? There are majorly three types of autoclaves, out of which we'll talk about two that are most commonly used. Namely, the first kind which is most commonly used is an N-type autoclave, which is mostly a top loading or a front loading autoclave. The second type of autoclave is a B-type autoclave or a B-class autoclave, and the third is the S-type. So S stands for steam pulsing. We don't need to know too much in detail about the steam pulsing autoclave, but we'll be talking more and more about the N-type autoclave and the B-type autoclave. So starting with the N-type autoclave, the alphabet N is mostly for non-vacuum type autoclave. So it is essentially the method of action of an N-type autoclave is by gravity displacement. So we displace the ambient air. So we have a load of instruments that we place inside the autoclave, and we pulse in steam inside the chamber, which with gravity settles down and pushes out the ambient air. So that is how an N-type autoclave works. The B-type autoclave, on the other hand, works on an absolute vacuum environment. You place your instrument load within the autoclave. You use a vacuum pump that pushes out the entire ambient air outside the autoclave, and thereby the steam is introduced into this absolutely vacuum chamber. Now, the advantages and disadvantages exist for both these kind of autoclaves. Starting with the N-type autoclave, it's very less expensive, so it requires like a very small amount of investment to be done. For a clinical practitioner, that could be of practical advantage if we have something that requires less funds to be delegated. We need less space in the clinic for deploying an N-type autoclave. It is one of the most, I would say that most of the media or most of the items that we use in a day-to-day dental laboratory can be sterilized in an N-type or a pressure cooker type autoclave. Now, how it works is, so there is like a heating coil that is present at the base of an N-type autoclave. There is this stand on which you're going to place your drum or the instruments on which they are going to settle down. There will be water up to a particular black mark which is mentioned in the autoclave, and a pressure setting will be available. So all autoclave cycles work at a particular pressure setting and a particular setting for temperature. Now for N-type autoclaves, we need 1.1 bar or 15 pounds per square inch. You may read this reference as psi or PSI. So 15 pounds per square inch is a good pressure for autoclaving your instruments in an N-type autoclave. So before you purchase your N-type autoclave, you need to check the black mark should be present for water. there should be a stand, there should be a heating coil present in your autoclave. Apart from that, you should have a drum to place your instrument, a rotatable, there has to be holes or perforations within that drum through which steam can enter the chamber, and you need to have a good working pressure valve. You need to have a meter that displays the pressure and a safety valve which you will close before setting up your cycle. So most of the instruments which do not require the presence of vacuum before you start autoclaving them would be instruments that are flat. You can use instruments without wrapping them in an N-type autoclave. So if I ask all of you, if you guys wrap your instruments, I'm sure 90% of the people will raise their hands and say that they do wrap their instruments before placing them in an autoclave, which is essentially N-type, which most of us are using in our clinics. So if you ask me, N-type autoclaves do not warrant you to wrap your instruments. They have to be unwrapped, which also essentially is a disadvantage for N-type autoclaves, because since we can only use unwrapped instruments in N-type or N-class autoclaves, there is a risk of rusting of the instruments or handpieces, and therefore handpieces can never be successfully autoclaved in an N-class device. Whereas if you have to talk about a B-class autoclave, the cycle time for a B-class autoclave is way longer than an N-type autoclave. Why I say so is because B-class autoclaves work on a vacuum setting. So when you purchase a B-class autoclave, the entire mechanism of action looks something like this. So there is a vacuum valve or a vacuum pump so from the chamber, from the autoclave chamber, there is a vacuum pump that is going to push out the entire ambient air, create absolute vacuum, and then push in the steam to autoclave the instruments. So the advantage will be that no matter if the instruments have a lumen, or they are solid, or there are air gaps in your load, so the entire load which has air gaps, it's hard for an N-type autoclave to sterilize such loads, because those voids or gaps will constantly have ambient air left in them, and the contact of steam with the instrument will not happen essentially. So the sterilization will be weaker or less verifiable. In case of a B-type autoclave, since there is a pre-vacuum stage involved, we push out the entire ambient air and then introduce the steam in the chamber. It makes sure that all the gaps, all the voids and areas are encapsulated in steam, and whether the instrument design is anything, like whether you want to sterilize your pipettes or you want to sterilize any material that needs to be wrapped, like specifically handpieces, we need a B-type autoclave because it needs to directly come in contact with steam through a wrapper. So since we can't wrap instruments in N-type autoclave, it's essential that whatever you want to wrap needs to be kept in a B-type autoclave. B-type is kind of versatile, so you don't have to invest in anything extra, and the pre-autoclave steps remain the same. So I will also discuss what the pre-autoclave steps are, but majorly if we have to discuss, N-type autoclaves are less expensive. They are, they occupy less space. They work on gravity displacement method of autoclaving or sterilization. They also can satisfy the requirements for most of our autoclavable instruments in a dental operatory. So you can say, like, most of the media that we are using, it's enough to have an N-type autoclave for them. Less expensive, they take less space, you don't need to wrap your instruments, the cycle size is way smaller because there is no vacuum phase involved. Whereas if you talk about B-class autoclaves, it's you need a vacuum phase that is involved. It increases the total cycle time, and also you need to wrap your instruments. It's far more expensive than N-type or pressure cooker type autoclaves, and the advantage being that it's one of the most versatile and predictable sterilization method that you can deploy in your practice. So we'll discuss some of the temperature settings that we should know before autoclaving our instruments. The pressure setting for N-type is 1.1 bar or 15 pounds per square inch, whereas pressure setting for a B class autoclave is 32 psi or 2.2 bar. Most of the pressure valves, if you'll see over your autoclaves, have the pressure setting written in bar. So that's why I'm mentioning it in bars. 1.1 is for N-type and the double of that, which is 2.2, is for B-type autoclaves. Going ahead, the temperature settings. There are three most common pressure temperature settings that we use for autoclaving our instruments. If your autoclave is capable of achieving a 134 degrees Celsius temperature, it's enough to autoclave your load only and only for 3 minutes. Whereas if you are autoclaving your load at 121 degrees Celsius, the desired time is 15 minutes, and for 126 degrees Celsius the desired time would be just 10 minutes. So these are the three temperature settings. One is 134, the second one is 126, and the third one is 121 degrees Celsius. So these are the two major types of autoclave. The third one, which we did mention, was a steam pulsing type of autoclave. The requirement of a steam pulsing autoclave would depend on what kind of loads you are using. If a particular device or an instrument mentions that it needs a steam pulsing cycle, it would be better to purchase one of those autoclaves. But otherwise, steam pulsing is a very limited usage, mostly used in hospital settings. The difference being it has a pre-vacuum stage, but there is a steam instead of like the pressure pump. There is a steam pump which pulses in steam through the vacuum. So that is the only difference. Else the entire structure is more or less like a B class autoclave. Now there is one tip which I want to add towards the end. Most of us, like, we are using isopropyl alcohol very handy. We keep isopropyl alcohol very handy in our clinics. If something falls down, or if before we autoclave our instruments, we like to wipe it with alcohol swabs and everything. Have you ever thought if it's really useful, or if it's doing something extra, or actually it's something that is harming your entire autoclave cycle? The answer is you should avoid using alcohol swabs before your autoclave cycles or even during them, because all the bacteria or microbial spores, they get dehydrated by using alcohol, and hence it renders it more resistant to sterilization. So when you wipe it with alcohol prior to autoclaving, like the surfaces of those instruments are going to be more resistant to getting rid of all the microbes on the surface of the instrument. So I would suggest not using alcohol swabs at all in your practices. And the second thing I would like to tell you is that always inspect your packaging before introducing the load in the autoclave. If the package is leaky, or the steam can enter the package and you will receive a wet package at the end, which is kind of very deleterious for the health of the instruments, because of the fact that the rusting can happen, and most of our handpieces are pretty expensive. So that is something that I would advise against. Apart from that, I would like to discuss in short some of the pre-autoclave steps that you need to follow, and we will do the same for handpieces as well. So the pre-autoclave steps are, first of all, you should use a mild detergent to scrub off all the debris from the top of your instruments using a gloves. It's better to use industrial gloves and not your examination gloves when you're trying to clean the debris off from your instruments, and thereby dry them, package them, and keep them ready for loading. Next would be when we clean handpieces, it's important that you expel the excess water and air from the pipeline before wrapping your handpieces. So step 1 would be expel the entire water or air that is present within the pipeline by running your handpiece briefly. Second step would be you need to oil the handpiece now, and So second step would be you scrub it. You scrub the handpiece with a mild detergent to get rid of the debris that might be settled on the surface. Third step would be again, oil it. You can use a dropper or a nozzle bottle to oil your handpieces. Thereby again attach it to the chair. Do keep your water setting off, and now try to expel the excess oil from your handpiece. So now the entire cartridge and the bearing of the handpiece is well oiled, and you don't have excess oil which will create an interface, like an oil and water interface, while you are doing steam autoclaving. So you have to expel the water initially, then you have to also expel the excess oil. Now that you have a well oiled, well cleaned handpiece, there is no debris. Now go ahead and wrap it, seal it in an autoclave safe pouch, and put it along with your load. Also make sure that when you're using N-type autoclaves, do not try to autoclave big loads, because the bigger the load, more the air gaps, and the steam penetration in an N-type autoclave is very weak, because there are pouches of ambient air that are present in the chamber. So if you have a vacuum autoclave or a B-class autoclave, it's great, you can go ahead and stuff it up. But in case of an N-type autoclave, your loads have to be smaller. Your instruments that are hollow or have a lumen are resistant to autoclaving through N-type autoclave, because it cannot enter gaps or hollow spaces. Steam is not capable of penetrating those areas in N-type autoclaves. And apart from that, if you guys have any doubt, I hope I have covered most of the details about both the most commonly used autoclaves. But you can DM us or write me in the comments if you want to know something else about the cycle, the timing, the pressure setting, and you can rewatch the video.